And joining us to talk about what the company does and its outlook is the CEO of LumiraDx, Ron Zwanziger. Ron, you're involved in COVID testing, which is obviously a huge growth industry. We hope it's not a sticky one, right? So what's the outlook for Lumira?
Well, so of course we created the platform that you might have seen that is underlying the reason why we've done the SPAC as a platform to transform the whole way community care is dealt with. And of course, we conceived this many years ago, well before COVID. And whilst we pivoted to COVID to be helpful in the pandemic, post-COVID, we will continue with the platform to address a whole host of diseases where you can address them more effectively in the community, such as diabetes, coagulation issues, infectious diseases, and so on. So the whole purpose of our platform is to have a single platform in the primary care setting, in pharmacies, in physicians' offices, where you can triage patients far more effectively than you can do today, with having very high performance tests which can be relied on. And this will lead growth well into the future. And that's really why we're doing the SPAC, much beyond just the fact that we're trying to be helpful in the short term with very high performing COVID antigen test.
Right, you've got a history at LumiraDx. You have big customers like CVS in the U.S., the National Healthcare Service in the U.K., the Bill and Melinda Gates Foundation. That's got to be a supreme vote of confidence. What else do you see as a real growth area then for LumiraDx, or what is going to be your bread and butter post-pandemic?
Well, so if you think that the type of products that we're focused on is helping people, for example, with diabetes, to know where they are and whether they've improved over time, to try and help in diagnosing heart attacks in such a way that you can triage patients very effectively when the ambulance shows up in the home, even before people are taken into the emergency room. We've got tests coming for one's called D-dimer, which helps physicians triage patients and make sure that they don't unnecessarily go into hospitals when the physician is suspecting fairly serious issues such as a stroke, where today you would send them automatically, but if you could do a test that triages that, you can stop inflicting that inconvenience on many people, because the percentage of people that actually need to be referred from the community into the emergency is low. So there's a string of products like those that we're bringing through, which we expect will drive our growth for many years to come. But I should say on COVID, it'll probably be around for a while too. So there'll be some residual benefit, some residual issues around COVID, and possibly not just antigen testing, but also testing around the vaccinations, first so that people can find out whether the vaccination is actually working, and later to find out whether the vaccination is still working.
Ron, can I just ask, we talked about the fact that it's one of the biggest deals, the biggest in the healthcare space in terms of SPACs. What are you going to do with the proceeds? What do you plan to use the money for?
Well, the funds are to expand capacity around the world. We're in the process of building additional plants in a number of areas, because these products that we're dealing with, which I just mentioned, and several others, we're seeing growth, and we're seeing demands from customers about expected volumes over time. So most of the capital that we're raising will be to build capacity.